This video presents the assessment, rehabilitation and reassessment of a patient 10 weeks post-surgical right elbow dislocation. Baseline testing identified deficits in range of motion, strength, grip capacity and load tolerance. A 3-week rehabilitation program was implemented, followed by reassessment to evaluate functional improvements. This is active elbow extension range of motion. The patient is standing and the goniometer is aligned at the lateral epicondyle with the stationary arm along the humerus and the moving arm along the radius. This is the right post-surgical side, demonstrating reduced extension. The left side is now assessed for comparison and shows greater range. This allows for objective side-to-side comparison. In this frame, we're comparing the patient's active elbow extension on both sides. The right arm achieves 143 degrees, whereas the left arm extends almost fully to 177. This demonstrates a noticeable reduction in range of motion on the right side compared to the left. Here we're assessing the patient's active elbow flexion. The right arm bends steadily and demonstrates good movement, though it doesn't reach as far as the left. The left arm achieves a noticeably greater range, showing more mobility compared to the right side. Here we're comparing active elbow flexion. The right arm reaches 125 degrees, though the graphic shows the remaining 55 degrees. The left arm bends further to 144 degrees, with 36 degrees remaining, showing greater mobility on that side. Here we're assessing active forearm pronation. The right arm rotates steadily, and the left arm achieves a slightly greater range, showing a difference in mobility between the two sides. Here we're comparing active forearm pronation. The left arm reaches 68 degrees, and the right goes a bit further to 72. Showing a small difference in rotational range between both sides. Overall, the difference is minimal and not functionally significant. Here we're looking at active forearm supination. Both arms achieve a very similar range with only a minimal difference. In this frame, we're comparing active forearm supination between both arms. The right arm reaches 88, while the left arm goes slightly further to 90. This small difference is minimal and not considered clinically significant, showing almost equal rotation on both sides. Here we're assessing passive elbow extension on the patient's right arm. You can see it extends well, although I feel a slight block at the end of the range. This is likely due to post-surgical soft tissue stiffness as the elbow continues to heal. For passive flexion, the same issue is apparent. Here the patient performs resisted elbow extension. He could only complete 3 reps with 5 kilos due to being apprehensive with this movement. For resisted elbow flexion, the patient could complete 7 reps at 5 kilos and stopped due to muscular fatigue rather than apprehension. Here the patient uses a hand grip dynamometer to measure his grip strength. You can see on his left arm he is able to try and produce more force. The patient recorded a grip strength of 26 kg on his left arm and 45 kg on his right, indicating a significant difference in grip strength between both arms. This is a measurement we will try to improve through our rehab plan. Here the patient performs a wall push-up. This is a functional load-bearing exercise that will be used throughout his rehab. Pre-rehab he could do 11 reps and stop due to muscular failure, with no apprehension throughout the movement. This is a somewhat challenging exercise that can be easily progressed. Here the patient completes a farmer's carry. This aims at improving his grip strength in a functional manner that can be easily loaded. Pre-rehab, he completed 30 seconds of walking with 2.5 kg in his affected hand. Here the patient completes a rotary stability exercise. This aims at loading the elbow, but also engaging the core muscles. Pre-rehab, the patient was able to complete 5 reps of lifting each extremity once, while experiencing some apprehension while loading his right elbow. Here I performed a valgus stress test on the patient's right elbow. He reports a pain of 3 out of 10 and has a little apprehension upon stressing the elbow medially. Here I perform a VAR stress test on the patient's right elbow. He reports a pain of 4 out of 10 and is quite apprehensive upon stressing the elbow laterally with noticeable laxity. This test is more painful as it is stressing the ligaments that he has previously injured. Here the patient performs resisted elbow extension with a band. This was selected to improve tricep strength and restore terminal extension control. This supports dynamic elbow stability while minimizing joint stress. Here the patient performs a bicep curl into a shoulder press. This exercise was chosen to improve bicep strength and integrate functional upper limb loading. This compound movement promotes coordinated strength across the elbow and shoulder joint. The wall push-up was also chosen as an exercise for his rehab to reintroduce closed chain loading and promote co-contraction around the elbow. This would also improve confidence and load tolerance, and the load can be progressed easily by lowering the hand height. Here the patient performs a one-arm row. This was selected to improve scapular stability and enhance proximal control while also reducing medial elbow stress. Here the patient performs active elbow extension post-rehab. We can see that his extension range of motion has improved greatly. In this frame we compare active extension pre and post-rehab and see that he has gained 17 degrees on his right arm after his rehab. This is over a 10% increase in extension over the 3 weeks. Here the patient performs active elbow flexion post-rehab. In this frame we are comparing his elbow flexion range of motion pre and post-rehab. We can see he has gained 8 degrees of flexion, but is also going into more shoulder flexion, which may be compensatory. Or he is now more comfortable in this position. Now the patient performs resisted extension post-rehab and is now able to unlock more fuller range and is less apprehensive during movement. By comparing this pre and post rehab, we can see he has increased his strength from 3 reps of 5 kg to 13 reps of 5 kg and is now stopping due to muscular fatigue rather than apprehension. Here the patient performs resisted elbow flexion. He is able to complete this with more range of motion and less apprehension, and is also now stronger with this movement. By comparing this pre and post rehab, we can see he has improved his strength from 7 reps of 5 kg to 9 reps of 9 kg. This is a significant improvement in strength in just 3 weeks. Here the patient performs a grip strength test post rehab. Here we can compare his grip strength pre and post rehab. Pre, on his right arm, he had 26 kg of grip strength and now has 36 kg. This is still behind his 45 kg on his left, but he has got significantly stronger. Here the patient performs a wall push-up post-rehab. This was an exercise included in his rehab program and he has since gotten significantly stronger. We have now been able to progress him to a bench push-up. We did this because he was able to complete 12 reps of a wall push-up at an RPE of only 2 with no pain. Here we can compare his wall push-up pre and post rehab. Post rehab we can see he is able to get into a deeper flexion of his elbow while still load bearing and is also leaning deeper towards the wall. This allows for more load to be able to go through his elbow while doing a functional movement. Here the patient performs a farmer's carry post-rehab. He is now able to load this with more weight and able to walk for longer with the weight in his affected hand. Here we compare the farmer's carry pre and post-rehab. Pre-rehab he was able to do 2.5 kg for 30 seconds and has since improved to 5 kg for 45 seconds. This shows an increase in grip endurance along with the strength from the dynamometer value. Here the patient performs the quadruped weight shift post-rehab. He is able to do this for more repetitions and less apprehension than pre-rehab. When comparing his quadruped weight shift pre and post-rehab, we can see that his reps have increased from 5 to 15 and his apprehension is now gone with this movement. When performing the VAERS stress test post-rehab, the patient had a 1 out of 10 pain and still had some slight laxity. For the valgus stress test, the pain was also 1 out of 10, so these have both decreased post-rehab. The justification for exercise selection, comparison of results pre and post-rehab, and further information on the assessment will be available in the surrounding text and tables.